the ILO from its origins recognized that decent work was a key piece of the puzzle to social justice and world peace. Over 100 years, the ILO has developed more than 40 instruments that focus on occupational safety and health. Current approach of the ILO related to occupational safety and health is very much focused on prevention, focused on creating the systems both at a national level and an enterprise level that are necessary to support occupational safety and health, and also creating a culture of prevention. So the idea being that if people think that work is just simply hazardous and that whatever happens is going to happen, no. Work, in fact, should not do harm, and work should support health. So you would think of all the sectors that would be conscious of health and safety, it would be the health sector. But actually what we find is this is actually a sector where workers suffer, often in many countries, the greatest percentage of injuries and ill health. And they tend to be selfless, and they tend to be people who will sacrifice their own well-being to help others. It's almost as if, because they're so focused on health, they don't need to worry about their workers' health. Some of the hazards are invisible, particularly to the public. So therefore, I think there's also a lack of recognition that in fact there are significant hazards in the health sector. And of course then there's the biological hazards, there's chemical hazards, the radiation hazards that are all part of the working environment. And so there's not easily compartmentalized, okay, this is the hazardous part of the work and everything else is neutral. You really need to have done your job in terms of assessing the hazards and risks, and to have a system in place that can proactively address them and evaluate, the success of those policies, and then make changes based on the results that you're achieving.
A OIT já disponibiliza para a sociedade um conjunto de documentos estruturantes, norteadores. São ferramentas bastante úteis e que podem ser utilizadas para garantir uma efetividade do combate à pandemia e também assegurar condições de trabalho decentes e dignas aos profissionais da saúde.
And so this then gets mixed up into actually there is a need for them to take care of themselves, and there's a need for them to be proactive about their safety and health. And again, like I said, you would think in the health sector that supporting health would be something that would be not something you would need to actually have, it should be obvious. So we just need to apply that kind of care that we want to give to the patients, to turn it around and say we need to similarly give the same consideration and the same compassion to the people who are providing the care.